All right, welcome to the white coat ceremony. So I am your host for this morning. I'm the Dean Bernard Costello of the School of Dental Medicine. It's very nice to welcome everybody here, particularly in person, friends and family, our current students, a number of our faculty members are here, and the class of 2024. We're here to celebrate the unique journey of the class of 2024, unique to say the least, who were admitted in 2020 during the pandemic, and their long-awaited official welcome into the dental profession with this white coat ceremony. Throughout the ceremony, you're going to hear from a variety of students, residents, our alumni president, and you'll hear about their transformative growth associated with Pitt Dental Medicine and what happens here. And I'd also want to recognize a number of our administrative team members that are here in attendance today have joined us in celebration of our students as well. A few words about this. So for those of you who might be traveling to Pittsburgh for the first time that are friends and family, welcome to Pittsburgh and welcome to the community of the School of Dental Medicine. We have a number of folks that are joining us on live streaming as well. So welcome to those. We're excited to welcome our new dental students. By extension, our hygiene students as well. Jerry, you got that? Sorry. I'll try to speak loud. And Pittsburgh, as I'm hoping you're finding, if it's your first time here, it's a spectacular city. It's been the University of Pittsburgh and UPMC that have been a big part of the renaissance of Pittsburgh in general over the last 20 years. And it's a good time to be part of what most people think is the most fertile ground in healthcare and healthcare education. We have 6 health science schools, all of which are rated and ranked in their top 15 in their various disciplines. UPMC is a top provider of healthcare in Pennsylvania with 4 million members in its own healthcare plan. They're the largest academic medical center anywhere on the planet. And Pitt Dental Medicine is 6th in NIH funding in the most recent funding list of FY20. All of that within walking distance of our School of Dental Medicine. So today, for the students, I want to challenge you, take it for what it is. Try to get as much out of it as you possibly can with this time that you have left. I can assure you there are a number of alums in the audience that are jealous of your opportunities. This is your time. It's your time to experience a new discipline, cross-train, open your mind. It's a time of your life to do that, and a wondrous time at that. We know it's hard work, but as you're going to think about today, I think a little bit more intently, the privilege of this white coat. That's why we do it. That's why we work hard. This is a symbol. It's a symbol of caring and respect. And for the doctoral students in particular, in a few years, we're going to be adorning you with a different symbol. And that seems like it's far off, but I can assure you it's not. That symbol being your cap and gown, that's the doctoral cap and gown, the hood with a lilac chevron on the back, and your tassel that you're going to move from right to left as you enter the profession more formally and get your doctorate. That transition will be really important. It's symbolic. It's symbolic of this professionalism that you're building during this time period as a student here. It's a symbolic of the excellence of dental medicine and dentistry. And it's a commitment to the patients that you're going to serve, a commitment to society, and to the ethics that are behind what we do as healthcare providers. We'll get back to that later a little bit with this pain. That's how I feel about it too. Wow. Sorry about that, little one. So it's a commitment. You guys okay back there? Because I can just yell. It'll be okay. It's a commitment to go above and beyond. And it's different than other jobs, right? It's a different type of commitment to do this. It requires a resilience, a compassion, certainly skill, intelligence, and a desire to do good. That's a very different type of thing than most jobs. It also requires that we be better every day and think about being better every day. We're human, but we strive for perfection, particularly in dental medicine, and we make errors, but we do our best to provide exceptional patient care. Those standards require morals and ethics to guide us in this practice of dentistry. So it's a responsibility, and it's not like other jobs, and that's what makes it special. That's what makes this white coat special today. You're going to hear about that. One of the other symbols is our university seal, which is another symbol of importance that was borrowed from William Pitt's family coat of arms and the city seal. It has a castle, 3 coins, and a couple of Latin words, veritas and virtus, truth and virtue. Healthcare demands those concepts, and you're going to wear these white coats with that charge in mind and a number of other things, trying to do your best for your patients and for your community. This place is very popular. You're a very elite group of students. At the time that you applied, there were about 2,200 applications for the 80 spots in this class. It's a high demand, and it's something that you're living up to. We can see that already in the time that you've been here. This rigorous curriculum that's not easy is your chance at becoming technically superior, but you're going to have to work at it, and of course it's going to be difficult. And that's what's required for you to have this privilege, the privilege of working with the public, healing them, and with their consent, prepping crowns, placing implants, performing surgery maybe, reconstructing faces and smiles. It all requires that level of commitment. So welcome to the brotherhood and the sisterhood of this great profession, and now it's up to you to do the hard work that's necessary for this and fulfill that promise. You want to earn the right to wear that white coat every day in the office. And if you achieve these things and you gain that right and reach that goal, you become a part of this privileged group that's consistently amongst the best jobs in America. There are reasons for that. In the pockets of these white coats that you're going to get today, you may find a little note from an alum. And I'd like you to think about that person's journey and how they got there. And then think about your own journey and where you might take it. So I want to offer you early congratulations in this process on your first steps forward in this journey to be professional.
Good morning. For those of you that don't know me, my name is Ariana Kelly, and I'm a recent graduate of Pitt Dental Medicine and a current dental anesthesiology resident here at Pitt. When I was first asked to speak at this year's white coat ceremony, I hesitated for a moment. Being a recent graduate, I don't even really consider myself a real dentist yet, and I feel like more of a baby dentist. And the title of doctor still feels a little weird to hear. I didn't think I had much wisdom to impart on all of you. However, I can relate to how all of you are feeling today. Just 4 short years ago, I was sitting where you are now, except it was my very first day of dental school. We had just come from dental anatomy, and we had learned about the 58 specific characteristics of the central incisor, whatever that was. It was overwhelming, to say the least, and I felt very undeserving of this fancy new coat I was about to receive. Over time, the meaning of my white coat has changed. It went from the first piece of white clothing that I had not yet stained with coffee to a symbol of professionalism, integrity, and commitment to my patients. While COVID has changed the usual timeline of your white coat ceremony, the meaning is still the same. In fact, it means even more now. At this point in your dental education, this ceremony represents the transition between your didactic and clinical years. Today, you will take an oath that will guide your decisions as you advance and grow in this profession, and I challenge you all to live up to the standards and values you promise. While there is normal anxiety within healthcare and the healthcare setting, I like to believe that when patients see a white coat, they feel a sense of calm come upon them because they know help is on the way. So congratulations on your first white coat and this amazing milestone in your career. You are part of the next generation of dentists, and I speak for all the dental professionals and Pitt Dental alumni here when I say that we are excited to have the best and brightest students joining our profession.
Thanks so much, Ariana. I was just thinking, with the microphone trouble, I was telling one of my colleagues, pretty much nobody else in the audience knows this story except one of my friends from a long time ago. I don't really get rattled by things like that because when I was in the 7th grade, I was playing the baritone saxophone, which is about this tall, and I sat down in the symphonic band and fell off the stage. right off the back of my chair. And then the saxophone fell on me. It was totally unplayable for the entire concert, which I faked the entire time. So don't worry about the microphone, Jerry. It's okay. So our next speaker is Samir Singh. Dr. Singh is a graduate of ours, good friend of mine for a long time, and an oral and maxillofacial surgeon locally here, who's going to speak to us next.
Good morning, everybody. How are you today? Sure you guys are awake after the noise that we just heard. Actually, before I wanted to get started speaking, I just wanted to give you guys a round of applause. Everybody give our students a round of applause. This is such a big day, and I want you guys to take it in and cherish it. As Dr. Costello had mentioned, my name is Dr. Samir Singh. I'm the president of our Dental Alumni Association and an alumni of the class of 2012. The school and the Dental Alumni Association are excited to have several alumni from the dental medicine family joining us here today, as well as virtually. As a graduate, I now more than ever appreciate the individuals who have dedicated their lives to making the dental education possible. Please know that your dental alumni network is available to you throughout your dental education and beyond. I encourage you guys to participate in future mentoring sessions and events as the world kind of normalizes. And as a quick aside, I'm the perfect person to kind of demonstrate the utility of the school and the alumni network. 10 years ago, Dr. Costello wrote me my letter of recommendation for residency, so I'm immensely appreciative. He helped me get here today, as well as the School of Dental Medicine at a mentoring event. Actually, the practice I'm with currently, I met one of the partners in the practice at that, and I eventually joined the practice. So everything worked out great. It is with great pleasure that I'd like to introduce you to our next dental student speaker, Marta Caceres Peguero, who will speak more about embracing the Pitt Dental Medicine family.
All right. So, class of 2024, you are looking good. My name is Marta Caceres Peguero, and I am a third-year dental student. So, I left the warm Florida sun to come to Pitt because they promise a collaborative and nurturing environment that they lovingly call the Pitt Dental family, as if you didn't know it already. And I'm here to tell you it's true. So, as you're nearing the end of your second year, I know that you're stressing about your transition to clinic. And well, the month before I started clinic, I was so frantic. My dog's anxiety got worse, and my family just had enough of me. I was trading in my mannequin Alejandro, named after my favorite mariachi singer, for a real-life human being that has saliva, blood, and feelings. I'd seen what I'd done to poor Alejandro for the past 2 years. His cheeks were torn, and no adjacent tooth was ever safe from my drill. I was petrified for my patients and myself. I watched in horror as my clinical partner filled up my schedule and told me my first ever appointment would be a filling. A one-surface occlusive filling, a number 31. I thought about this tooth every waking hour, and I dreamt of mandibular molars. My clinical partner called every day, talking me through every step and mostly just making me feel better, but I was still a nervous wreck. But at least I knew he had my back. The night before, I didn't get any sleep, but it didn't matter. I was running on fear. I knew exactly what to do. I walked into Mod 3. I saw my name as a provider on the board for the very first time ever, and I froze. I had no idea what to do. I couldn't find the tape for the barriers. I forgot how to set up my cubicle. The fourth years nearby must have seen the fear in my eyes because they set up my cubicle and then they stood in the dispensary line with me and told me exactly what to grab. My clinical partner came in and helped me navigate Axiom, present to faculty, and write my note. I had Dr. Phil check every millimeter, and he didn't object once. Instead, he encouraged me, guided me, and built up my confidence. That one surface filling took a village, but I can happily report that the filling is still in there. And Dr. Phil is still my #1 hype man. And all of my classmates have similar stories to this. And you will too. You are ready, and we are here to support you and pump you up. So we are your village, and we're in this together. We can't wait to have you in clinic. So congratulations, class of 2024. You've all made me so proud.
Thanks so much, Martha. So our next contributor and speaker is my good friend, Dr. Charles Spear, who's the Associate Dean for Research and an exceptionally talented researcher in regenerative medicine.
Good morning, everyone. Welcome and congrats. That's a wonderful day. I'm Dr. Charles Fair. I'm the Associate Dean for Research at Pitt Dental Medicine. As a nationally recognized research powerhouse for discovery, innovation, our school is currently ranked sixth among the National Institute of Health. So the National Institute of Dental and Craniofacial Research is the leading organization that actually provides a metric how we do on research. And so currently we are ranked number 6. The School of Dental Medicine is really privileged to have highly talented, world-class, renowned researchers that do interact with our students and interact with all of you. So please take advantage of that. We're here to work with you, so that actually will be wonderful. So it's now my pleasure to introduce our dental student, Ami Trivedi D, and to highlight more about student research experience here at Pitt Dental. Ami?
Hello, everyone. First and foremost, I want to congratulate you all on this great achievement. I know that everyone here has worked very hard to be in this position and have been working hard for the past 2 years in dental school. There are many things I could talk to you about as you begin this next chapter, but I'm here today to focus on the impact and importance of research. My path to oral health research began at a faculty-led talk in my second year, where Dr. Burgett spoke about her research on the social determinants of health. I've always been passionate about public health, and hearing how research on social determinants have affected recommendations to support children's oral health inspired me to get involved. I dived into research, motivated by a drive to expand our collective knowledge and make a difference. This semester was one of firsts. It was my first semester providing dental care in the student clinic, and my first semester submitting a manuscript for publication in a scientific journal. The research mentorship has afforded me the opportunity to learn how to conduct high-quality research, and it was time and effort well spent. Research is also giving me an opportunity to talk at an international conference and present my findings to scientists from around the world. I feel an immense sense of accomplishment since I'm able to contribute to an important body of knowledge. High-quality scientific research is the foundation for the evidence-based decision-making that influences how we, as future dental professionals, see the world and make clinical decisions. Knowing how research works and contributing to it has opened my eyes to a crucial element of the profession and empowered me to better serve my patients. Pitt Dental Medicine consistently has some of the best clinician scientists in the country, investigating a whole range of interesting and unique research questions. I encourage all of you to find a subject or a project that you're passionate about, contact a faculty member, and ask how you can get involved. Trust me, you won't regret it. Congratulations, class of 2024, for all that you have accomplished so far. Pitt Dental Medicine is full of opportunities for you, and I look forward to continuing to get to know your class as you enter the clinic. Thank you.
Thanks so much, Ami. Jerry, if you could advance those slides along, that'd be great. Thanks so much. So in just a little while, you're going to recite the dental oath with Dr. Christine Wankari-Hale. And I mentioned those morals and ethics and the responsibility associated with what it is that we do. Most of that dental oath was borrowed from what most people refer to as the Hippocratic Oath, taken from the writings of a philosopher, Hippocrates II, who lived in the classical period, reportedly around 460 BC. He was a Greek physician who helped form the profession. And we grew out of that. This is a philosopher that was a contemporary of Plato and Aristotle. We grew out of that as a profession in the 1800s more formally, and the Hippocratic Oath is part of the corpus writings which were used to formulate this dental oath, and it's the seminal writing on healthcare ethics in general. That's where our commitment begins, and I want to highlight a commitment that I'd like you to consider as you step into this role of a healthcare provider, even as a student, and it's one that has significant responsibility. The opioid crisis has ravaged our country, and particularly the region of Western Pennsylvania and this entire Appalachian corridor. It's been like a social tornado tearing apart the lives of individuals, families, communities, and entire regions. It's unfortunately uniquely devastating, and it's gotten worse during the pandemic. We have been appropriately very, very focused on what we do to fight this pandemic, and I think we're just about there. The opioid overdoses went up 29% during the pandemic. CDC has reported that we lost over 100,000 people to overdose during the pandemic. Highest number of overdoses ever recorded in our country. We've had a 500% increase in overdoses in our region alone in the last decade. All of this at a cost of about $1.5 trillion to the country. Now is the time to double down on efforts to restore our communities and fight the crisis. We in dentistry are a big part of this solution. You are, and you particularly as the future. How you step forward and lean into this responsibility could mean the difference in a person's life, between a life of addiction or one that has success and contribution. One moment in time, one prescription written the right way to make the difference. One of our alumni, Dr. Omar Abubakar, who happens to be the mentor of Dr. Singh, he's an oral and maxillofacial surgeon and good friend of mine as well. He lost his son to addiction after an opioid prescription for an orthopedic procedure. That brought him to the world of narcotics. He now is a champion for this cause, like I am, and I'm asking you to consider this pledge as you move into your careers. We developed the responsible pain care prescribing guidelines at Pitt with Paul Moore, a number of our other experts in the faculty, to give you the tools to make the right choices as clinicians, non-narcotic choices whenever possible. Break glass in case of emergency approach to narcotics instead of a just-in-case approach. First year we used this approach at Pitt Dental Medicine. In the middle of the pandemic, we decreased our prescribing of narcotics by 54% and the following year by 48%. You can make a difference just by doing this. So today, I'd ask that you think carefully about this responsibility and consider the commitment. So I'm going to read this first part for you, and then my job also is to get you ready for Dr. Juan Carey Hale. You're getting your reading skills on, so you can read aloud with me after this first part, and then the oath will come after that. So as a conscientious healthcare professional, the immediate and long-term health of my patient is my highest priority. It's incumbent upon me to evaluate all of the options regarding effective and safe treatment of acute pain for those patients who require administration of medications or other strategies to mitigate and treat their discomfort. Therefore, I make the following commitment to my colleagues and to those I care for whom pain treatment remedies are required. So these will be up on the screen for you to read aloud, or follow along if you like, if you don't wish to read aloud. I believe that the health of each patient is my paramount concern when considering treatments and therapies. I recognize that addiction to opioids and other addictive substances is a critical health problem for many and a health crisis that my profession can conscientiously affect. I will treat patients with compassion when choosing their pain treatment options. I will carefully employ prudent decision-making regarding the safe and effective prescription of pain medications and therapies for my patients. This includes considering the guidelines for prescribing pain medications and the most current evidence-based recommendations into account. I will make personalized choices to determine the best options for each patient. For the good of all, I am committed to avoiding the preferential use of narcotic pain and other addictive medications whenever possible, as based upon the most current principles. In accordance with my oath as a healthcare professional, I hereby pledge to hold myself to the principles of this pledge and the highest ethical standards regarding medication prescription. If you want to learn more about this, there's a white paper on our website. It'll be published in the Pennsylvania Dental Journal in the coming months. And there's additional information there. If you're a clinician of any kind in the audience, if you're a nurse practitioner, physician, anyone having anything to do with prescribing, you can get this information and indeed take the pledge if you like on our website. It's all available. With that, I'd like to happily introduce my colleague, Dr. Christine Wankari-Hale, Associate Dean for Student Affairs, to begin the process of giving you your white coats finally.
Thank you, Dr. Costello. Dr. Costello, Pitt Dental family and friends, it is my honor to finally introduce to you this class of pre-doctoral dental students. This ceremony is generously supported by the White Coat Endowment Fund established by Dr. Zahn and Feldman. Members of the extended Pitt Dental Medicine family, including alumni, faculty, staff, and students, as well as friends and family of the students, have also supported the White Coats. Dental students, please rise and join with me in reciting the dental oath, which can be found on the screen or in your program. So let's recite it together. I, realizing the privileges and opportunities that will be given to me in my study of the arts and sciences of dentistry, and appreciating the significance of the dental diploma to be conferred upon me, do hereby willingly pledge that I will diligently uphold the dignity, honor, and objectives of the dental profession, and to the best of my ability will contribute to its prestige, proficiency, and progress. That I solemnly accept my responsibility to the patients to give them the best of my knowledge and skill, and to maintain an impeccable relationship with them that will warrant their trust and confidence. That I will faithfully observe the principles of ethics set forth by the profession. That I will lend my influence and support to dental education, to organized dentistry, and to all segments of the profession to contribute to the fulfillment of its purpose. Please be seated. We will now begin the presentation of the white coats that will be presented to the class of 2024. The coats will be presented by Associate Dean Oakley, who will be joined by Dean Costello to congratulate the students. This will serve as a rehearsal for graduation. So I'll ask the students to please rise row by row and proceed to the stage to receive your white coat when your name is called. Audience, please reserve your applause if you can until the end. And as a reminder, we're asking you to refrain from shaking hands. So we'll begin. I'd like to present Javad Amani from Tehran University, Shiraz, Iran. Presenting Eunice Amoko from the University of Western Ontario, from Toronto, Ontario. Introducing Shayla Artiga from the University of Delaware, Seaford, Delaware. Please welcome Philip Ashkar from Rhode Island College and the University of Connecticut, from Seekonk, Massachusetts. Introducing Marissa Baranski from Michigan State University, Clinton, Michigan. Welcome Spencer Barber from Duquesne University, Bridgeville, Pennsylvania. Introducing Colton Brown from the University of Pittsburgh, Newcastle, Pennsylvania. Sharice Brown from Howard University, from Kingston, Jamaica. Please welcome Brandon Butcher from the University of Florida, Beaver Falls, Pennsylvania. Welcoming Catherine Carnevale from Virginia Tech, Pittsburgh, Pennsylvania. Introducing Nicholas Chapasco from the University of Dayton, Fallowfield, Pennsylvania. Please welcome Anthony Chen from the University of Michigan, West Bloomfield, Michigan. Introducing Max Chu from the University of Pittsburgh, Yorba Linda, California. Please welcome Nicole Choka from the University of Kentucky, Erie, Pennsylvania. Introducing Alexis Dearborn from the University of South Carolina, Northfield, New Jersey. Please welcome Melody DeMattis from the Youngstown State University, Johnstown, Pennsylvania. Please welcome Sarah Dixon from Pennsylvania State University, Gibsonia, Pennsylvania. The next student will be presented by her father, Dr. Kurt Dora, from the Pitt Dental Medicine class of 1987, and her mother, Miss M.J. Dora, Pitt Dental Medicine faculty. Please welcome Abigail Dora from the University of Pittsburgh, Elwood City, Pennsylvania. Welcome Hannah L. Arabi from the University of California at Los Angeles, San Clarita, California. Please welcome Blessing Elensi from the University of Florida, Tampa, Florida. Introducing Amr Irfan from the City College of New York, Brooklyn, New York. Please welcome Nathan Figueroa from the Virginia Commonwealth University, Pittsburgh, Pennsylvania. Welcome Reed Fry from the University of Pittsburgh, Belle Vernon, Pennsylvania. Introducing Sarah Galco from the University of Pittsburgh, Pennsylvania. Introducing Vincenzo Giovanetti from John Carroll University, Pittsburgh, Pennsylvania. Welcome Teja Gumadi from the University of Pittsburgh, Austin, Texas. Introducing Katherine Hansen from Ohio State University, Winston-Salem, North Carolina. Please welcome Victoria Hart from High Point University, Pittsburgh, Pennsylvania. Introducing Abigail Hasson from University of Miami, Florida. Welcoming Sarah Lynn Hill from Clemson University, Charleston, South Carolina. Please welcome Kelsey Hohen Sarek from Virginia Tech, Pinehurst, North Carolina. Introducing Orella Hudson from Rutgers University, Union, New Jersey. Welcoming Caitlin Hines from Lafayette College, Dunkirk, Maryland. Please welcome Fadi Ibrahim from the University of Pittsburgh, Pennsylvania. Please welcome Ryan Jenkins from St. Mary's College of Maryland and Georgetown University, Dunkirk, Maryland. Please welcome Matthew Jenny from Arizona State University, Lakeville, Minnesota. Introducing Madison Yuschuk from John Carroll University, Chester, West Virginia. Please welcome Lauren Carr from Emory University, Charleston, West Virginia. Introducing Rohit Kirtan from Washington and Jefferson College, Pittsburgh, Pennsylvania. Please welcome Rachel Kerr from the University of Scranton, Archbald, Pennsylvania. Please welcome Susanna Keys from the University of Utah, Salt Lake City, Utah. Please welcome Charbel Qatar from the University of Rhode Island, Providence, Rhode Island. Introducing Mia Kanavish from the University of Pittsburgh, Pennsylvania. Introducing Karina Kunka from Kenyon College, Moseley, Virginia. Introducing Morgan Lamy from St. Joseph's University, Hockessin, Delaware. Welcoming Yugi Lee from the University of Massachusetts at Amherst, Seoul, South Korea. Please welcome Yuri Lee from Georgetown University, Seoul, South Korea. Welcoming Jordan Lundquist from Brigham Young University, Ligonier, Pennsylvania. Please help me welcome Courtney Marchant from the University of South Florida, Lakeland, Florida. Introducing Zachary Martik from the University of North Carolina at Chapel Hill, from Elizabeth, Pennsylvania. Welcoming Carmen Massoun from the University of Pittsburgh, Pennsylvania. Please welcome Miranda Mazzio from St. Joseph's University, Philadelphia, Pennsylvania. Welcome Elena Mikaloff from Waynesburg University, Mariana, Pennsylvania. Introducing Regina Munch from the University of Pittsburgh, Pennsylvania. Welcome Michael Pelliconi from the St. Lawrence University, Spencerport, New York. Please welcome Dylan Patel from the University of Florida, Orlando, Florida. Welcome Owen Poling from the University of Pittsburgh, Limerick, Pennsylvania. You're welcome. Introducing Eric Pomper from Case Western Reserve University, Pittsburgh, Pennsylvania. Please welcome Maggie Prokovich from the University of Pittsburgh, Elwood City, Pennsylvania. Welcome Archana Ramesh from the University of Pittsburgh, Pennsylvania. Please welcome Shanna Ridgely from the University of Pittsburgh, Farm Belt, Pennsylvania. Welcome Andrew Roman from Boston College, Williamsport, Pennsylvania. Please welcome Minahil Sami from the University of Scranton, Jessup, Pennsylvania. Introducing Shafali Savri Ryan from the University of Pittsburgh, Venetia, Pennsylvania. Please welcome Ashley Schelling from Washington and Jefferson College, Pittsburgh, Pennsylvania. Introducing Joya Shah from the University of Wisconsin at Madison, Zhejiang, China. Please welcome Jiaming Jim Shi from the University of Western Ontario, Toronto, Ontario. Welcome Tiana Saldeki Han from the University of Pittsburgh, Elkins Park, Pennsylvania. Welcoming Zoe Stenholm from Grand Valley State University, Muskegon, Michigan. Please welcome John Nathan Stolley from Auburn University, Houston, Texas. Introducing Samantha Tetlak from the University of Florida, Green Lawn, New York. Please welcome Jada Turker from the University of Virginia, Leesburg, Virginia. Welcoming Stephanie Veloso from the University of Florida, Oviedo, Florida. Please welcome Bailey Wathen from Salisbury University, Leonardtown, Maryland. Introducing Lucy Wen from the University of Maryland at College Park, Boys, Maryland. Please welcome Robert Yost from Illinois State University, Des Plaines, Illinois. Please give a huge welcome to Vivian Zhao from the University of British Columbia, Vancouver, Canada. Would everyone please join me in officially congratulating and welcoming the class of 2024 to the Pitt Dental family. Please stand up, class of 2024. Please rise, class of 2024.
Thanks, Christine. Okay, you guys can be seated. So, rowdiest crowd ever, just saying. Congratulations to the class of 2024. This is the conclusion of today's ceremony, which would not have been possible without the combined support of our Office of Student and Alumni Affairs, as well as the generous contributions of our alumni and friends who sponsor those white coats, and particularly Drs. Harry Zahn and Cecile Feldman, the White Coat Fund that they set up. Please be sure as you exit to grab yourselves an iconic Pittsburgh Eaton Park cookie, but I kindly ask you to hold on to it until you're outside so we're compliant with the COVID protocols. One last note, please, students, if you would stay seated, we'll direct you outside for a class photo. Once our students have exited, you can reconnect with your families and friends. Thank you very much, everyone. It was really a lot of fun to get together. Everyone have a great day. Students, you can stay right there.